Hello, this is Tanisha Macklin from Peaceful Birthing Doula. Thank you for joining me. Today's topic for postpartum recovery is why do you need to recover from postpartum from birth, right? What is one of the things that could potentially happen? So I asked a few questions, and one of the questions I asked on my website, on my Facebook page, was what would you like to hear about? What is one of the things that concerns you with birth that makes you nervous? And one of my beautiful mamas posted that she was concerned about tearing. So everybody's worried about tearing. Unfortunately, I experienced tearing, but my recovery was amazing because it was a vaginal birth. I only needed 1 or 2 stitches, but I stuck to the regimen that was given after to recover from the tears. So one of the things you can do to prevent tearing, and this doesn't happen for everybody. Everybody will not tear. You can have a couple things happen. You can actually tear, and there's a number of degrees. There's first degree, second degree, third degree. And I know a lot of people are concerned about episiotomy still. Physicians are no longer doing episiotomies, or at least they shouldn't, because there's really not a need to do episiotomies. Having a natural tear is a better way to heal as opposed to being cut. So some physicians are not doing it. You need to, if you're not sure what your physician's style of practice is, you need to have that conversation with them to see what their viewpoint is on episiotomies, just to ensure that they line up with no episiotomy, natural tear. If you do a natural tear, you heal better, you heal quicker. So there is a couple things. You can get what are called skid marks. These are little micro tears that can happen in the vagina during the course of the stretching when baby is coming out. Then there's the first degree, second degree, and third degree tear. If for any reason you have to have an episiotomy, it is because they are trying to prevent tearing in the wrong direction. So if you tear downward toward the rectum, they don't cut, because that's not a necessary thing. But if you start to tear up toward that artery, you might get clipped. It just depends. Some people have crazy births where stuff happened and they're just physiologically, their body will tear transversely on the sides. I've had a few moms where they've experienced some labia tear. You just don't know what your body's going to do. But your recovery will still be the same. You may or may not have to have stitching, but you should do what's necessary. The video after this will be showing you how to recover, reduce inflammation, and heal from that. But what we're going to talk about today is preventing tearing. So one of the things that I teach in my comfort measures class and my labor prep class is the perineal massage. Perineal massage is massage that is given to the perineum, which is that rim of the vagina. So your goal is to make sure that there is no tearing, which means you need to have good, healthy blood flow in that tissue. There needs to be elasticity in that tissue. And what better way to do that but make the hubby do a little homework, right? Now, I know some of you all are pregnant. You like, look, he did enough. I'm pregnant. I don't need him doing nothing. Well, understand, it's going to look a little weird trying to find your vagina with the belly in front of it, right? So just let him have a little fun. He can't bother you for 6 weeks. Go for it, right? I always tell the dads, look, you're going to have 6 weeks where you're not even going to be able to see it. Enjoy it, please. It's a little playground. Go down there. So what I tell moms to do is to do what's called the perineal massage. And we're going to imagine this is your vagina, right? Now just think about it. This is your vaginal hole. And then this human being is going to come out that's going to be 10 centimeters, and they're going to open your vagina this wide. Now, no, it will open that way. It is going to do it. Has no choice. Baby's going to stretch you, which is that ring of fire that you're going to feel. But during that time of that ring of fire, sometimes moms have a little extra urge to push when they shouldn't be pushing. And if they do push, it can encourage tearing. Or If baby has a bit of a large head, it can cause a little tearing, or if baby has hand in the face, or if baby is up here some kind of way. Sometimes the way babe comes out can cause tearing, sometimes just physiologically it could happen. So we're going to just talk about preventing it, right? So what I want you to do is you're going to take your two pinchy fingers and you are going to massage the rim of the vagina. No pinching, just the pinching fingers. And you're going to use a water soluble oil. So you can find whatever your fun oil is. You could do coconut oil, jojoba oil, something that will be hypoallergenic, something that will not cause any yeast infections or any kind of infections down there, right? So you're going to have a little bit on the two fingers, and then you're going to go along the rim, right? The best time to do this is after you've had a wonderful and relaxing warm bath. So you're going to do the bath. After the bath, you're going to do a warm compress on the vagina. After you've done the warm compress on the vagina, two pinchy fingers, and then you're going to do the rim. Now, this is tissue, so much like massage, you can manipulate it. But I don't want you doing anything crazy. You're going to take your index finger and you're going to hold on to it, right? We're not pulling. We're not stretch it out. No. What you're going to do is you're going to hold on to it and you're going to just get the resistance and let it sit there. That's it. You're not pulling. You're not doing anything. And you're going to do the rim several times on both sides. And the same thing. You get over here, a little bit of resistance. Again, we're not pulling. You're not trying to tear. You just want to give a little resistance to encourage that tissue to become elastic-like. So dads, if you're watching this, if you want mom to have a wonderful snapback with her vagina so it can all go back to where it was, we're not going to do anything crazy. Do the perineal massage so you can get what you want, and then you can prevent her from tearing, right? So once you've done that, then you're fine, okay? Keep doing that consistently. I tell people to start doing your perineal massage maybe around week 35, maybe week 36, as frequently as you like. There is no time frame on there. Remembering, make it a relaxing thing. Take a nice hot and warm bath. Do the warm compress directly onto that area. Please, not scalding hot water. I don't want you sending me messages that your vagina swole up because it's got scalded. We're going to be logical mamas. Just because it's warm, we don't want to scorching hot. If it's scorching hot, that doesn't mean more blood is going to flow to the area and make it better. We want it warm enough that it is able to increase blood flow but not scald you. You should still be comfortable in it, okay? And then what I want you also to do is to relax and enjoy it. Yeah, you may be a little annoyed being touched, especially down there because you're pregnant, and some mamas are hypersensitive and will absolutely love it. Either way, do it for the end result of not being torn. Dads, I want you to be responsible and making mom feel comfortable during that time. Sometimes some mamas are uncomfortable with being touched in that manner, knowing that you're fiddling around down there. So please be responsible. If you want things to be okay, take your time. There's no hurry. And then also find out if your physician does perineal massage during your birthing experience. Some of them will do it and they will put lubricant down there and do the massage, and you may or may not even know it. Please ask your physicians or your midwives if they do it. Some of the doulas out there encourage having you do it. I encourage my clients to do perineal massage. I also, when things are going quickly, I try to put the warm compresses on the vaginas while moms are laboring, or have the dads do it. Whichever is quicker is what I'll do. And then I'm also reminding, the more you relax, the better it can be. Labor is work, hence it's called labor. But if you can submit to your body and allow that experience to happen without pressuring yourself, things will go a little bit smoother. So, beautiful mamas, I thank you so much for watching my video. I appreciate your time. I thank you. It's been an honor to be a part of a lot of your lives and to even be welcomed into your homes and for you to even use my information as a resource. You are welcome to call, ask any questions, to email me any questions, or you can go online and watch any other resourceful videos that I have available. My website is peacefulbirthingdoula.com. You can email me at peacefulbirthingdoula@gmail, and you can call the office at 630-635-2189. If I don't get back to you, please know that I will. Every phone call, every email is important to me. I appreciate you considering to even ask me any questions and utilize me as a resource. Please give me 24 hours to get back to you. I may be with the birth or I may be with other clients. So I thank you so much. And I hope and pray that you guys have a wonderful day. God bless. Okay.